Good morning, Mrs. Allison. My name is Vanessa, and I will be your nurse today. I'm going to go ahead and close the door for your privacy and put you in supine position. Okay, I'm going to go ahead and start off by performing hand hygiene for 20 seconds. Okay. How are you doing today, Mrs. Allison? Good. That's great to hear. Do you have any allergies to chlorhexidine or any adhesives? No? Okay, perfect. What about your pain? Are you in any sort of pain? No? Okay, that's good. What about your general physical condition? Are you sleepy, tired, hungry, or are you in any discomfort? Oh, you're having urinary retention. I'm so sorry to hear that. Okay. I'm going to go ahead and check your wristband. Okay, may I have your name and date of birth? Allison Swift, January 9, 1975. I'm so sorry to hear that you're having urinary retention. Well, your doctor went ahead and wrote you an order for a Foley catheter to insert it into your bladder and help drain some of that urine, okay? To help you with some of that retention. I have my supplies here with me. However, I would like to go over the procedure a little bit, okay? So I'm going to go ahead and cleanse the genital area and then insert the sterile soft tube, or also known as a catheter, into your urethra, which is going to help drain some urine from your bladder, okay? Once it's in place, I'm going to go ahead and inflate the balloon with some sterile saline and to help hold it onto place. And then I'm going to go ahead and secure the catheter on your thigh using a style lock to make sure it doesn't move out of place and cause you any discomfort, okay? So this procedure shouldn't hurt, but it might be a little bit uncomfortable, okay? Do you have any questions or concerns about the procedure? Or you're wondering how long it will be in place? Well, it depends on your doctor. And so it could be either from 1 to 3 days, okay? Hopefully that helps with your urinary retention, okay, and lets you urine after the removal, okay? I'm going to go ahead and clean the table now. Do you have any other questions before I begin? No? Okay, perfect. Okay, I'm going to go ahead and perform good hand hygiene for 20 seconds, and I'm going to go ahead and put on some gloves. I'm going to go ahead and clean the table with a sandy wipe. Okay. How are you feeling, Mrs. Allison? Good, okay. Do you have any pets? Oh, you do. You have a cat. What type of cat do you have? You have a ginger kitty? Oh, I've always wanted a ginger kitty. I've heard they're quite chaotic at times. Is that true? Yeah, one of them broke your vase. Oh, wow. They do seem chaotic. Hopefully you're able to replace that vase soon. Okay, we're just about done. I'm going to go ahead and throw this away and remove my gloves. I'm going to go ahead and perform hand hygiene, and I'm going to go ahead and cleanse your genital area now, Mrs. Allison. Okay, do you want a warm blanket? It might feel a little cold. Yes, okay, perfect. I have a warm blanket for you. Don't you worry, Mrs. Allison. Okay, I'm going to go ahead, pull your gown down. Okay, I'm going to help you, assist you into a froggy position, okay? Okay, perfect. I'm going to go ahead and put the blankets on you so you don't get cold on me. Okay, and then I'm going to go ahead and place this choke down just as an extra safe measure. Okay, I'm going to go ahead and cleanse your area with a perineal wipe. I'm going to go ahead and take the first one, and I'm going to go ahead and clean the left side of your labia all the way down to your anus. I'm going to go ahead and dispose of that. I'm going to go ahead and take another wipe, clean the right side of your labia all the way down to your anus. And then I'll take the third and final wipe and clean down the middle all the way down to your anus. Okay, perfect, Mrs. Allison. I'm done cleaning your genital area. I'm going to go ahead and remove my gloves and prepare my supplies, okay? Okay. I'm going to go ahead and perform good hand hygiene for 20 seconds and put on a clean set of gloves. Okay. I'm going to go ahead and gather my supplies. So I do have a mask on. As you can see, I have my Foley kit that I'm going to place here, a stat lock, 10 ml syringe, and a CHG wipe. I'm going to go ahead and carefully remove the Foley kit out of its packaging. And I'm going to set this aside here. I'm going to go ahead and open it away from me, and here I do have a sterile drape. I'm going to go ahead and carefully pick it up, only making sure to touch the 1-inch border. Then I'm going to go ahead and place this on your, with only touching the 1-inch border with the shiny side down. Okay, Mrs. Allison, how are you feeling? Good? Okay, I'm going to go ahead and continue to open the kit, making sure to only touch the 1-inch border to keep a sterile feel. I'm going to go ahead and carefully pick up the gloves and set aside as we do. There will be a sterile procedure. Okay, I'm going to go ahead and drop my syringe carefully. Okay, that was nice. I'm going to go ahead and drop my stat lock now. Okay, perfect. Then I'm going to go ahead and drop in my CHG wipe. Okay, I'm going to rip that in half, and then I'm going to rip it in half again. And I'm going to wiggle it as I do not want to touch. Maybe I need to cut it in half again. Okay, perfect. Okay, I'm going to go ahead and remove my gloves, perform hand hygiene, and then we will begin the sterile procedure, okay? And put on some sterile gloves. Mrs. Allison, are you having any discomfort or pain? No? Okay, perform hand hygiene for 20 seconds. Do you have any questions or concerns, Mrs. Allison? Why? Oh, you're asking why we need sterile gloves. So this is a sterile procedure. We want to make sure to prevent any bacteria from getting into your urethra, okay? Okay, I'm going to go ahead and grab the glove by its cup, making sure not to touch the inner part of the glove. Okay. Okay, that's nice. And okay, I'm going to go ahead and grab the other glove by its cuff, making sure not to touch the inside. And that went on well. Okay, I'm going to keep my hands like a T-Rex now. I don't want to break sterile. Okay, I'm going to go ahead and prepare my supplies, okay? So I will be moving things around. I'm going to go ahead and place stat lock and prep pad here, the alcohol swab, the urine sample over here. I'm going to go ahead and remove the sterile water and the lube, and I will remove this tray. I'm going to go ahead and remove the sheet from the catheter, and I will put this on the tube with the lube, and then I'm going to go ahead and throw this away and put the sterile water, connect the sterile water. Okay, make sure that's tucked into the box, and I'm going to go ahead and put my swab sticks there. Okay, I'm going to go ahead and grab the box that's like this, and I'm going to go ahead and place this between your thighs. Okay, Mrs. Allison, I'm going to go ahead and cleanse your inner part, urethral meatus, okay? The urethral opening, okay? Where the tube is going to go. Okay, I'm going to go ahead and do 3 swipes. So I'm going to clean the left. 1 swipe, dispose of that. Another swab. This is betadine swabs. Clean the right. Okay, perfect. And I will clean another one down the middle. Okay, perfect. And then I'm going to go ahead and insert the catheter now, okay? On the count of 3, I want you to blow out, Mrs. Allison, okay? 1, 2, 3, blow out. Okay, I see some urine. I'm going to go ahead and advance it 1 to 2 more inches. Okay, and then I'm going to go ahead and inflate the balloon. Okay, I'm going to remove this, and then I'm going to slightly Tug on it to feel some resistance. Okay, perfect. The catheter is in place. I'm going to go ahead and pull down your gown a little bit. Okay. How was the procedure, Mrs. Allison? Good. Okay, I think it went pretty smoothly. I'm going to go ahead and remove the swab sticks as we will be doing. Yeah, okay. I'm going to go ahead and change my gloves, and then I'm going to go ahead and secure the stat lock, the catheter into the stat lock, okay? And grab. I'm going to go, before I do that, I'm going to go ahead and collect the urine sample. So I'm going to go ahead and grab the CHG wipe. I'm going to go ahead and clean this for 5 seconds. Okay, I'm going to let it air dry for 5 seconds. And then I'm going to go ahead and take my syringe, twist it in place, and I'm going to grab 5 to 10 mLs of urine, making sure not to tug on. Okay. I grabbed 10 mLs. I'm going to go ahead and place this aside. I'm going to go ahead and change my gloves now, and then I'll put on the stat lock, okay? Okay, perform good hand hygiene, 20 seconds, and then I'm going to go ahead on a clean set of gloves. The serial procedure is over, so I'm going to go ahead and tuck the drape as we will. It's okay. I'm going to go ahead and prep the thigh, the protectant pad. I'm going to go ahead, while that dries, I'm going to go ahead and secure the catheter into the stat lock. Okay, and I'm going to go ahead and place this on your thigh. Okay. Okay, and then I will be removing the box as we will not be needing that. And then I'm going to go ahead and hang the Foley bag on the frame of the bed, hanging below the bladder. I will make sure that there's no kinking or any dependent loops to allow the urine to flow through. And then I'm going to go ahead and remove the drape as we will not be needing that. And along with the chucks, I'm going to go ahead and assist you into froggy position and put your gown down. Would you like to keep the warm blanket, Mrs. Allison? Yes? Okay, I'm going to go ahead and cover you up now. I'm going to go ahead and change your gloves. How did you tolerate the procedure, Mrs. Allison? I'm going to go ahead and perform hand hygiene for 20 seconds. Oh, it was good? Okay, that's great to hear. I think the procedure went pretty smoothly as well. I'm going to go ahead and put the urine sample into its container, okay, and we'll go ahead and send that to the lab. Okay, I'm going to go ahead and carefully remove the cap and gently pour this into the cup, making sure not to touch the edges or the inside of the cup. Okay, perfect. I'm going to go ahead and dispose of that. Put the cap on. And I will go ahead and set this aside to send to the lab. I'm going to go ahead and put the name, date of birth, the date of today, the time, and your MRN, and I'm going to send that to the lab, okay? I'm going to go ahead and dispose of this, and then I will be out of here. Mrs. Allison, how was the procedure? Good. Are you feeling any pain? No? Any questions? No? Okay. Perfect. So I'm going to go ahead and document now. The procedure was done on October 28th at 1 p.m. The patient tolerated the procedure well. The 14 French catheter was used. 300 cc of clear light urine was draining with no foul smell. And I will be performing hand hygiene and leaving Thank you, Mrs. Allison.